Hi everyone, welcome back to my channel. So I'm going to be doing sort of like well, not a series. I created a playlist for stiff person syndrome in light of the news that Celine Dion has been diagnosed with SPS. And I had already done a few videos because I myself have been diagnosed with stiff person syndrome, and there were already a few videos you know, on my channel about SPS, but I had not made a dedicated playlist to the condition. It's a very rare condition, and I also have been diagnosed with Lyme disease in the past, and that's actually more probably more common than we think. And so I dedicated this channel mostly to just chronic conditions or speaking about chronic illness in general. But now that SPS is sort of, at the forefront, we have one of the biggest celebrities in the world that has been diagnosed with this condition. I wanted to talk more about it and in more detail. So I created a playlist. It's called, I think, Stiff Person Syndrome or Stiff Person Syndrome playlist. So you can see all of these videos there in that playlist. So I'm going to be making, more videos about this, some commentary on, Celine Dion and how people are reacting to that. But I wanted to first make, I already had a video talking about SPS, but there are different types, or there are two different versions of this condition. The condition that I have is basically, and I believe the condition that Celine Dion has is the autoimmune condition. It's just, it's like an autoimmune illness that affects your muscles. There is another type, and it is called the paraneoplastic type. And there are different types of neurological conditions that are paraneoplastic. That they can be non-paraneoplastic, which is more like an autoimmune illness, but they can also be paraneoplastic. So what is paraneoplastic? So paraneoplastic means that it's a disorder that affects, for example, SPS would be, paraneoplastic SPS would be a rare disorder that affects your nervous system in some individuals that also have cancer, specifically when it comes to SPS, specifically breast and lung cancer. So regular SPS, autoimmune SPS, does not involved with cancer. Paraneoplastic typically means there is cancer. So it's the same. It's a very similar symptoms, stiffness and rigidity, along with very painful spasms. But it's typically associated with a different auto antibody. So regular SPS, as you have seen in my other videos, and check out my playlist, is associated with GAD65 or anti-GAD65 antibodies. The paraneoplastic type, the one that is associated with cancer, is associated with anti-amphiphysin antibodies. I don't know if I'm pronouncing that right, but it's spelled AMPHIPHYSIN. So anti-amphiphysin antibodies. So paraneoplastic neurological syndromes, there are many different ones. So not just SPS, there are other ones that are associated with the paraneoplastic, the cancer type of situation, but we're going to focus on SPS for this video. So there are a group of neurological syndromes that affect the nervous system, brain, spinal cord, nerves, and muscles in patients with cancer. So if you hear paraneoplastic, it means cancer. That's the simplest way that I can explain it. Paraneoplastic means that the neurological syndrome is not caused by the tumor itself. So it's not caused by the cancer, but it's caused by your immune response to the tumor that's there, the cancer. Your immune system starts to react like, I know there's something here, and then it starts to it's, of course, it sees the tumor as an invader, but the immune response is pretty intense, and it starts to attack you and attack your nervous system. So it's basically like collateral damage. It's trying to hit this one specific thing with a lot of force and ends up hitting a lot of different other targets that it's not meant to hit. This can lead to damage to the nervous system, and the damage to the nervous system can sometimes exceed the damage to the tumor. So paraneoplastic SPS or paraneoplastic neurological syndromes can remit entirely, so they can go away completely, or they can leave lasting permanent effects. So you're not going to know until you're treated. And we'll talk about that in a second. So each paraneoplastic neurological syndrome is associated with a different antibody. Like I said, stiff person syndrome, paraneoplastic stiff person syndrome is associated with anti-amphiphysin, but there are other conditions. There are other paraneoplastic neurological conditions that are associated with other antibodies like CRMP5, MA2, anti-NMDAR, and so on and so forth. But like I said, for the purposes of this video, we are focusing on paraneoplastic SPS, which is associated with anti-amphiphysin, if I'm pronouncing it correctly, antibodies. By the way, the sun, we're having a lot of rain out here in California right now, so the sun is coming in and out. It's kind of crazy right now. So hopefully you guys can still see me. I'm also working with a different camera, so hopefully it looks okay. First line of treatment is to remove the cancer. They got to get rid of the cancer, whether it's surgery, radiation, chemo. So you need to get rid of the cancer because remember, your immune system is reacting because there's something there. There is a tumor, there is a cancer. Most of the time it is cancerous. I believe it's typically cancerous with stiff person syndrome. I know with some of the other paraneoplastic syndromes, you can have a non-cancerous tumor, but I believe like 9 times out of 10, it's typically cancer, especially with SPS. So you got to get in there, get that cancer out, treat the cancer first, because remember, that's what your immune system is reacting to. Then immunotherapy, depending on the type of antibodies present or what kind of paraneoplastic syndrome you have. So for SPS, you're typically dealing with the same thing. So it's almost like you remove the cancer, and then if you're still symptomatic, typically I think people are still symptomatic, then you have to go in with the sort of typical stuff that you treat SPS with, which would be steroids, IVIG. I was taking IVIG. There's also something called plasmapheresis, where they take your blood out, and I think I explain it in the stiff person syndrome video. So they take your blood out, they separate like the antibodies from the plasma, and then they like put your blood back in. So basically taking out all of these the negative antibodies to get it out so that those antibodies are no longer there in your system. And also physical therapy. So, it's a typical, it's like once you remove the cancer, then you're dealing with SPS. Obviously, it's harder because you just went through cancer treatment. So it's not the same exact thing. So you're recovering from one thing and then having to go through immunotherapy to get that, to get your body sort of back in order, to get your immune system back on track. And of course, PT, because of the stiff muscles and stuff like that, will also help. So like I said, steroids, IVIG, plasmapheresis, physical therapy. So this typically works for these patients that have been treated for cancer. If their cancer has been successfully treated, they do the immunotherapy, and they can achieve remission, because obviously it was the cancer that was causing this reaction. Once the cancer is gone, and you can get your immune system back on track with immunotherapy, you're in remission and you're doing good. There are some people, yes, that have lasting damage, or for whatever reason, their immune system just doesn't bounce back the way that it used to. But for the most part, I think most people can achieve remission or a lot of improvement with their symptoms by going through the treatment that I just described. For those patients that have achieved remission, their cancer is in remission, their paraneoplastic SPS or their other symptoms have improved and are doing better. If their symptoms come back, for example, if they start experiencing stiffness again and the painful spasms, their SPS symptoms, that typically means that their cancer is back. So that's kind of, one of those things that I guess once you've had the SPS, the paraneoplastic SPS, if your cancer comes back, that will typically come back as well. Typically, it's the other way around. You'll start feeling those symptoms first, the stiffness, the spasms, and then that's like a telltale sign that your cancer has also returned because your immune system is mounting that response again and it's going haywire. So that's kind of one of the sort of bad parts, is that not only do you have the cancer, you also have this paraneoplastic syndrome that is also coming back. So it's like a double whammy. I do know, I spoke to a man many years ago when I was first pursuing my my diagnosis for SPS, and his wife had the paraneoplastic SPS, and she was in really bad shape. She had gone through cancer treatment. She was cancer free, or they had gotten rid of the cancer, and she was still in really, really bad shape. And they had done treatments. I believe they had done immunotherapy, things like that, and she just was not bouncing back. And I remember, I reached out to him because I found him on a forum. At the time, I didn't really know much about his wife's condition. He was looking for help for his wife. It was a really heartbreaking situation because he was just he was obsessed with figuring this out. Because his wife, I think, was like really incapacitated. I don't know if she was still in the hospital at that time, but she was just in really bad shape. And he just kept telling me, he's like, I don't think you have this. I don't think this is what your issue is. And I could tell that he was just so desperate because he would tell me his wife's situation and all of the stuff they had done for his wife. But obviously that's not the same thing as what I have. She had the paraneoplastic version. She had long-lasting complications from that, and her I guess her immune system had just gone haywire and had never bounced back from that, no matter what they did. So it is possible that even once the cancer is gone, that you can still continue to have symptoms of SPS or the other paraneoplastic conditions that maybe improve somewhat or don't improve at all. So I just wanted to make that clear that it's not a foolproof thing. This is very, very rare as well. If typical stiff person syndrome is 1 in a million, this is even less than that. The cancer, the paraneoplastic version, is even more rare than typical stiff person syndrome. So I just wanted to make that clear because I did know that was my first exposure to the paraneoplastic version of SPS, and it was just so heartbreaking. This man was, and I'm sure that they're older now, they're probably retired, and he was just going crazy trying to help his wife, and my heart broke. My heart completely broke for him because I could tell that it was all that he could think about is just getting his wife better. But anyways, I don't want to end it on such a depressing note, but that's every time I see, paraneoplastic or paraneoplastic SPS, I always think of him because he was my first, he was, I think, also my first contact with someone, after I started to suspect that I had SPS, and he actually helped me, and he was back and forth with me, and he was telling me, who I needed to see and who I needed to talk to. And I think there's a reason why I contacted him, and that will be in the next video. So stay tuned for that one. But anyways, thank you so much for watching my video. If you have any other questions, I'll do my best to answer them because I'm not as familiar with the paraneoplastic version of SPS. I'm actually not really familiar with either one because they are so rare. But if you have any questions, leave them down below. Please like and subscribe, and I will see you in the next one. Take care.